Intimate wellness after 60. A gynecologist reveals 5 common self-care fails. Have you ever experienced a moment of quiet reflection where you thought to yourself, I have been taking care of my body my entire life, so why do I still feel so uncomfortable? If you are a woman navigating life beyond the age of 60, you may be genuinely surprised to learn that many of the very routines you have trusted for years, the same habits you firmly believed were helping you, might actually be making matters worse. And the unvarnished truth is, you are not alone in this experience. I am Dr. Lily Stones, a gynecologist with over 3 decades of experience dedicated to helping women through every single stage of life. And allow me to tell you, one of the most frequent and important conversations I have with my patients revolves around the topic of self-care. I am not referring to the glamorous kind you often see depicted in magazines, complete with luxurious bubble baths and scented candles, but rather the quiet, intimate, and deeply personal self-care that protects your daily comfort, your essential circulation, and your fundamental confidence. Here is the shocking part. When women neglect this crucial kind of self-care, or when they practice it in the wrong way, the consequences do not just affect their capacity for intimacy. It can markedly increase vaginal dryness, elevate your risk of recurrent infections, contribute to the weakening of your pelvic muscles, and can even impact how you carry yourself in your everyday life. And the most heartbreaking part of all is that many women do not even realize they are making these mistakes until years of compounded discomfort have piled up. Let me share a story with you that captures this predicament perfectly. A woman, whom I will call Elena, aged 72, came to see me after suffering for months with persistent burning and irritation. She sat down in my office, her expression a mixture of frustration and despair, and said, "Doctor, I simply don't understand. I wash myself every single day with the strongest soap I can find. I thought I was being exceptionally clean, but I only feel worse and worse." Upon examining her, I realized that the harsh, chemical-laden products she had trusted for decades were systematically stripping her body of its natural protective defenses. What she had genuinely believed was exemplary self-care was, in fact, the very root of her discomfort. Elena left my office that day feeling both immensely relieved because she finally had an answer, and deeply frustrated because no one had ever taken the time to tell her that more aggressive cleaning was not synonymous with better care. And Elena's situation is far from unique. According to the renowned Cleveland Clinic, more than half of all postmenopausal women experience some form of intimate discomfort, and yet the vast majority of them never connect it back to their own daily habits. These women come to believe that their suffering is simply a normal and unavoidable part of the aging process, when in reality, many of their struggles stem directly from common mistakes that could be easily and effectively avoided. I like to compare it to the care of a delicate, antique lace shawl. Imagine you decide to scrub this intricate fabric every day with a harsh detergent, believing you are preserving its beauty. Over time, instead of remaining pristine, the delicate threads would begin to fray and break down. Or imagine you never properly store the shawl, leaving it exposed and brittle. The shawl would still exist, but it would appear worn, fragile, and neglected. Your body is much the same. The wrong kind of care, or a complete and total lack of care, does not protect you. It quietly and insidiously wears you down. This is precisely why today's discussion is so critically important. We are going to talk about the 5 most common self-care mistakes that women over 60 make. These are not rare or unusual behaviors. They are the everyday habits I see over and over again in my patients. And the chances are you might be making 1 or 2 of them yourself without even realizing it, but please do not worry. By the end of this video, you will know exactly what those mistakes are, why they are so harmful, and what simple, natural alternatives you can begin using today. And let me be perfectly clear, this conversation is not about shame. You have not done anything wrong. The truth is, most women were never taught how to properly adapt their self-care routines after the profound changes of menopause. We grew up hearing maxims like cleaner is better, or damaging myths such as intimacy isn't important at your age, or leakage and dryness just happen, so you have to live with it. But modern science and decades of my own patient care tell me a very different story. Your body has an incredible capacity to thrive when you provide it with the right kind of thoughtful attention. So, as we go through this information together, I encourage you to listen with a sense of curiosity, not with guilt. You may very well recognize yourself in 1 or 2 of these mistakes, and that is perfectly okay. Awareness is the essential first step toward meaningful change. Now, let me ask you, when you think about your own personal self-care, Do you feel confident that you are supporting your body in the right way? Or have you ever wondered if some of your long-held habits might be doing more harm than good? I would love for you to share your thoughts in the comments, because chances are another woman watching this is wondering the exact same thing. Stay with me, because in just a moment, I will begin walking you through mistake number 1. And I promise, it is something you may not expect. Let's dive into the first mistake, one that I see with such frequency in my practice: over-cleaning with harsh soaps or using douches. Many women hold the belief that being extra clean necessitates washing multiple times a day with strong perfumed products. After all, we have been taught since childhood that cleanliness is next to godliness. But when it comes to your intimate health, especially after menopause, over-cleaning can inflict far more harm than good. According to the Cleveland Clinic, the vagina is a naturally self-cleaning organ. It produces its own secretions that help to flush out harmful bacteria and maintain a healthy, balanced ecosystem of protective organisms. When you introduce harsh soaps or chemical-laden douches into this delicate environment, you disrupt that natural balance. The beneficial bacteria are killed off, the tissues become dry and irritated, and you may actually become more vulnerable to developing infections. One of my patients, Patricia, aged 74, illustrates this point perfectly. She was meticulous about her personal hygiene, showering twice a day, scrubbing vigorously with antibacterial soap, and even using a commercial feminine spray because she thought it was necessary to keep her feeling fresh. But over time, she developed a chronic, unyielding burning sensation and suffered from recurrent urinary tract infections. Patricia confided in me, "Doctor, I truly thought I was being careful. I never for a moment imagined that my own hygiene routine was the problem." Once she ceased using all harsh products and made the simple switch to using only warm water and a gentle fragrance-free cleanser just once a day, her symptoms improved dramatically. Her story serves as a powerful reminder that sometimes, more is not better, especially when it comes to intimate care. I often compare it to the process of washing a fine silk garment. If you were to scrub a delicate piece of fabric with bleach every single day, would it last? Of course not. It would fray, lose its texture, and wear down far more quickly. Your tissues after menopause are just as delicate as that silk, and they require the same gentle, thoughtful care. Overcleaning is not protection. It is a slow, methodical destruction of your body's natural defenses. Now, let's talk about the second mistake: ignoring the critical needs of hydration and natural moisture. After menopause, your estrogen levels naturally decline. This hormone is not just about fertility, it plays a crucial role in maintaining the elasticity and thickness of your tissues. As estrogen decreases, your intimate skin becomes thinner, drier, and more fragile. Without adequate support, even simple everyday activities like walking, sitting for extended periods, or exercising can begin to feel uncomfortable. Many women simply accept this as an unavoidable part of just getting older, but that is not true. Dryness and fragility are signals that your body needs your help. The Mayo Clinic reports that up to 50% of all postmenopausal women experience the symptoms of vaginal dryness. That is half of all women in this age group, and yet so many of them never seek out solutions. Why? Because they feel embarrassed, or because they incorrectly assume that nothing can be done. But both internal hydration and external moisturizing are incredibly powerful tools. Drinking enough water each day supports your tissues from the inside out, while applying a safe, high-quality, water-based moisturizer or a specialized vaginal gel provides help from the outside in. These are not luxuries. They are basic, essential forms of self-care. I remember a woman named Ruth, aged 68, who had started to avoid social gatherings because she was in a constant state of discomfort. She confessed to me, "Doctor, I don't even feel like myself anymore." She rarely drank water, relying instead on coffee and tea throughout the day, and she never moisturized her intimate area because she thought it was completely unnecessary. When we added just 2 simple steps to her routine, drinking water regularly throughout the day and using a fragrance-free moisturizer twice a week, her level of comfort improved dramatically. She came back to my office smiling and reported, "I can finally sit through a full church service without squirming." Sometimes it is the smallest of adjustments that can restore both our physical ease and our emotional peace. Think of it this way: would you leave your hands unmoisturized all winter long and expect them not to crack and bleed? Or would you plant a beautiful flower in bone-dry soil and expect it to bloom? Your intimate tissues are no different. They require steady, consistent hydration, both inside and out, in order to remain supple and strong. So when you combine these first 2 mistakes, overcleaning and ignoring moisture, you begin to see a destructive pattern. One action strips away your body's natural defenses, while the other deprives your tissues of the very nourishment they need to stay healthy. Together, they set the stage for discomfort, chronic infections, and even a precipitous decline in your self-confidence. Here is what I would love for you to reflect on. Have you ever thought you were doing the right thing by washing too much or by skipping moisturizers, only to realize later that your body felt worse, not better? If so, you are not alone. Many women share this exact experience, and talking about it helps to break the pervasive silence. Please share in the comments if either of these mistakes sounds familiar to you. You might be surprised by how many other women will nod in recognition when they read your story. And please stay with me, because the next mistakes we will talk about may shock you. They do not just involve hygiene, they touch upon your relationships, your confidence, and even your personal independence. The third mistake I see far too often is avoiding intimacy altogether out of a profound fear of discomfort. This often happens quietly, almost without conscious notice. A woman may have one painful or uncomfortable experience, and then she begins to hesitate. Over time, she withdraws more and more, until intimacy becomes something she no longer even considers. She tells herself that this is simply a part of aging. But here is what I desperately want you to understand. When you cease all forms of intimacy, whether it is with a partner or with yourself, you do not protect your body. You actually accelerate the very problems you are trying to avoid. The Cleveland Clinic has shown through extensive research that regular stimulation helps to maintain healthy blood flow, keeps the tissues flexible, and reduces the thinning process that so often leads to pain. Without that vital circulation, dryness worsens, muscles weaken, and discomfort grows. It becomes a vicious, self-perpetuating cycle. Fear leads to avoidance, avoidance leads to more physical pain, and the increased pain reinforces the initial fear. I remember a patient named Helen, aged 70, who came to me almost in tears. She said, "Dr. Jones, I have completely closed that chapter of my life. My husband doesn't even try to come near me anymore because I always push him away." When I explained to her that even the most gentle forms of touch, holding, caressing, or mindful self-pleasure could help to restore blood flow and ultimately reduce her pain, she was utterly shocked. She thought that part of her life was over. But what she truly needed was a new, more compassionate approach. After a few months of taking small, tentative steps, she told me, "For the first time in years, I don't feel broken. I feel hopeful." The fourth mistake is believing that lubricants are only for sexual intercourse. This one truly surprises many women. They walk past that particular aisle in the pharmacy, thinking that lubricants are only for younger couples, or they feel a deep sense of embarrassment to even place one in their shopping cart. But lubricants are not just for intercourse, they are everyday tools for comfort. They protect your delicate tissues from tiny tears, they reduce painful friction, and they help to restore a sense of confidence in your own body. One woman, whom I will call Denise, aged 66, admitted that she had always avoided buying lubricants because she thought it was shameful. She whispered to me during her appointment, "Doctor, that's for other women, not for me." But after she finally tried a simple, high-quality, water-based lubricant, she came back to my office laughing. "Why did I wait so long?" she exclaimed. "This feels like I gave myself back a piece of my life." That is the truth I wish every woman over 60 could hear. Lubricants are not a sign of weakness, they are a smart, proactive form of self-care. And then there is the fifth mistake, one that gets overlooked again and again, forgetting the pelvic floor. Your pelvic floor muscles are like a supportive sling, holding up your bladder, your uterus, and your rectum. With age, and especially after the hormonal changes of menopause, these muscles naturally weaken. When they are ignored, this can lead to urinary leakage, pelvic organ prolapse, and even a noticeable loss of sensation. Yet most women never think about actively exercising them. According to the Mayo Clinic, pelvic floor exercises, or Kegels, can significantly improve both strength and circulation, even in older women. These exercises do not require any special equipment, and they take only a few minutes a day, but the benefits they provide can be truly life-changing. One of my patients, Maria, aged 72, used to avoid going to her granddaughter's soccer games because she was terrified of having a leakage accident when she laughed or cheered. After 3 months of performing daily Kegels, she came to me beaming. "I went to every single game this season," she reported, "and I didn't have a single accident." That newfound freedom gave her back more than just physical comfort. It gave her the confidence to fully rejoin her life. When you look at these 3 mistakes together, avoiding intimacy, dismissing the value of lubricants, and neglecting the pelvic floor, you begin to see a clear pattern. Each one of them stems from silence, from embarrassment, from the deeply ingrained belief that after the age of 60, These things simply do not matter anymore, but they do matter. They matter for your physical health, for the quality of your relationships, and for your personal dignity. I want you to pause for a moment and reflect. Have you unintentionally slipped into one of these patterns? Maybe you have avoided intimacy because of past pain, or dismissed lubricants because of a perceived stigma, or simply forgotten about the vital importance of your pelvic floor. You are not alone. Millions of women are quietly struggling with these very same issues, but the good news is that with increased awareness and small, consistent changes, your body has an incredible capacity to respond, even decades after menopause. So let me ask you, of these 3 mistakes, which one feels most familiar to you? And which one feels like the easiest place for you to start making a positive change? Please share in the comments. Your words might be exactly what another woman needs to hear to take her very first step forward. And stay with me, because in the next part, I will share the story of a woman who completely transformed her health and her confidence by correcting these very mistakes. Her journey proves that it is never too late, and it might just inspire you to begin your own. To truly understand just how powerful it can be to correct these common self-care mistakes, allow me to share with you the story of a woman who walked into my office, carrying the weight of years of frustration, and walked out months later with a renewed and vibrant sense of herself. Her name was Carol. She was 68 years old, and a retired librarian. When she sat down across from me, I could almost physically see the burden she carried. She said, "Dr. Stones, I feel as though my own body has betrayed me. Everything feels dry, uncomfortable, and I don't even let my husband come near me anymore." She confessed that she had been scrubbing daily with harsh soap because she believed it was good hygiene. She admitted that she had been avoiding intimacy because every single attempt had ended in pain. She had never once used lubricants. She thought they were only for younger women. And she had never, not once in her entire life, done a single pelvic floor exercise. By the time Carol came to see me, she was not just dealing with a list of physical symptoms, she was carrying the heavy burdens of shame, a growing distance from her partner, and the firm belief that her best years were far behind her. She whispered to me, "I guess this is just what happens after menopause. Maybe I should just stop expecting anything more." But here is the profound truth. Our bodies may change after menopause, but they never stop deserving our care. I told Carol exactly that. Together we created a plan, not an overwhelming or complicated one, but a gentle and consistent one. Step 1, stop using the harsh soaps and switch to warm water and a mild fragrance-free cleanser, just once a day. Step 2, focus on hydration by drinking water throughout the day and using a simple vaginal moisturizer twice a week. Step 3, introduce a high-quality, water-based lubricant, not as something shameful but as a practical tool for comfort. And Step 4, practice pelvic floor exercises for just a few minutes each night before going to bed. At first, Carol was skeptical. She told me, "Doctor, I have lived like this for so many years. Can a few small changes really make a significant difference?" But within just 6 weeks, she returned to my office smiling. "I don't feel that constant burning anymore," she said. After 3 months, she joyfully told me that she and her husband had shared intimacy again, gently and without any pain for the first time in years. And perhaps most importantly, she looked me directly in the eye and said, "I feel like I belong in my own body again." Her remarkable transformation was not the result of magic. It was not due to surgery or any expensive medication. It was simply the result of awareness of replacing damaging mistakes with beneficial habits that honored the way her body had naturally changed. I often explain it with this analogy: your intimate health is like a delicate ecosystem, like a tide pool. If you completely neglect it, the vibrant life within it recedes, and the environment becomes barren. If you flood it with harsh chemicals, you destroy the natural balance. But if you tend to it gently, with clean water, the right nutrients, and consistent attention, that ecosystem can flourish again, even after many seasons of change. Carol's body was the same. For years she had either neglected or inadvertently mistreated this delicate ecosystem. But once she began to provide it with consistent, thoughtful care, it bloomed again with health and vitality. Science unequivocally confirms what Carol experienced. The National Institutes of Health has noted that women who maintain regular self-care routines after menopause not only reduce their physical discomfort, but also report a higher quality of life, a better overall mood, and improved relationships. The benefits extend far beyond the physical. They touch upon our confidence, our capacity for intimacy, and even our social engagement. Carol's story reminds me of something I wish every single woman over 60 could hear. It is never ever too late. Even if you have been making these mistakes for years, your body is incredibly resilient. With small, consistent changes, you can experience improvement, not a continued decline. So let me ask you from the heart, if you were to imagine your own personal ecosystem, how would you describe it right now? Has it been neglected, overtreated with harsh elements, or is it simply waiting for a little bit of tender, loving care? And what would it mean for you personally to see it flourish again, not just for your body but for your confidence and for your joy? We have covered a lot of ground today, so let's take a deep breath and reflect on what we have learned together. The truth is, most women over 60 are doing their very best with the knowledge they possess, yet, without realizing it, they often fall into 5 very common self-care mistakes. Mistake number 1, overcleaning with harsh soaps or douches, which strips away the body's natural defenses. Mistake number 2, ignoring hydration and natural moisture, which leaves the tissues fragile and dry. Mistake number 3, avoiding intimacy altogether, a practice that only accelerates tissue thinning and discomfort. Mistake number 4, believing that lubricants are only for sexual intercourse, when in reality, they are simple, effective tools for everyday comfort. And mistake number 5, forgetting the pelvic floor, those essential muscles that support our strength, our continence and even our sensation. Each of these mistakes, when considered on its own, may not seem catastrophic, but when they are added together over time, they quietly chip away at our comfort, our confidence, and our overall quality of life. What starts as mild dryness can evolve into recurrent infections. What begins as one painful experience can lead to years of avoiding intimacy. What feels like minor leakage can grow into a debilitating fear of leaving the house. This is not just about physical health. It is about our dignity, our relationships, and our freedom to live without fear or shame. But here is the most hopeful part. Every single one of these mistakes can be corrected, and the solutions are not complicated. They are small, natural, and consistent habits. Choosing to use warm water instead of harsh soaps, drinking water throughout the day and adding a gentle moisturizer to your routine, allowing yourself to experience gentle intimacy, with or without a partner, to maintain healthy circulation, embracing lubricants as an ally, not as a source of embarrassment, and practicing pelvic floor exercises daily, just as naturally as you brush your teeth. These are not radical, life-altering changes, they are quiet acts of respect for your body. I think back to Carol's story, the woman who felt that her body no longer belonged to her. She thought it was too late, that nothing could possibly change. But by letting go of the old mistakes, and embracing these new nurturing habits, she found her way back to comfort, intimacy, and a profound sense of self-confidence. And if Carol could do it after years of struggle, so can you. I like to imagine 2 distinct paths stretching out before women after the age of 60. On one path, self-care is neglected or misdirected, and as a result the body grows more fragile, confidence shrinks, and intimacy fades into a distant memory. On the other path, self-care is actively nurtured, the body is supported, intimacy becomes gentle and fulfilling, and confidence radiates outward into every aspect of life. Both of these paths are possible, but only one of them leads to a life of dignity and vitality. And the choice, starting today, is entirely in your hands. So here is my invitation to you. Choose one small step to take this week. Maybe it is putting down the antibacterial soap for good. Maybe it is adding a moisturizer to your weekly routine. Maybe it is doing just 10 pelvic floor squeezes tonight, before you go to bed. You do not have to change everything all at once, but one small change, repeated consistently, has the power to transform your health and your confidence over time. And I would love to hear from you. Which of these 5 mistakes resonated with you the most? And which small step are you willing to begin taking today? Please share your answer in the comments, because your voice could be the very thing that encourages another woman to take her first step too. If you found today's video helpful, I invite you to subscribe so you do not miss the rest of this series. In the next episode, we will explore the natural self-care habits that not only protect your intimate health, but also help you to thrive with energy, comfort, and joy, well beyond menopause. And before we close, let me remind you, this video is for educational purposes only. It does not replace medical advice. Every woman's body is unique. If you are experiencing pain, significant changes, or have personal concerns, please consult with your healthcare provider. Your well-being deserves personalized care.